So my colleagues have spoken to you a lot about the data and about a lot of the hard work that's going in around the hospitals and in the HPO in improving those data and ensuring that the HYPE data that we have available is absolutely premium for everybody to use. When I was reflecting on this piece about 2 years on in data quality, it struck me about how in the last 2 years I have come in contact with more clinical staff, hospital staff than ever before in a very long time working in HYPE, and that's really enriched my work because to have those connections, and I'm sure those of you who do this work out in the hospitals really appreciate that. So I just wanted to share with you some of the projects that we've worked on over the last 2 years that have really helped us to do those projects and improve the quality of HYPE data. And I want to thank all of those people that have come forward and helped us, because we really do need that input. So I just have some slides on working together, on the HYPE data. I've just put up there a sample of some of the reports that have used HYPE data, and I'm going to go through some of those. Not least is our own activity in acute public hospitals HYPE report that is continues to be published every year, and it is a font of extremely useful information. I suppose the clinicians and the wider system, I just want to talk about working with those as opposed to just working with the HYPE coders, where we would have spent all our time, and it has been great to hear, as Maureen said, to hear clinicians presenting on HYPE data and discussing it as opposed to giving out about it or what's wrong with it, that it actually is valid data that can really support the systems. They're using, reviewing and presenting on HYPE data. The linking in with HYPE coders and the HPO team, as I say, has been unprecedented in the last couple of years, and really has made a huge difference and is very much appreciated. And I think that's really seen with that uplift in those slides that Jackie had there about the improvement in quality. And generally an increased engagement with the HYPE system, and many of you here will have come to us to ask maybe, could we include something, could we look at something, could we provide data, could the HYPE portal, could the IT team do something for you? And we have some speakers this afternoon from our colleagues in NOCA who we work very closely with, and the increased engagement, and I suppose it all brings clinical coding really up to the fore. These are just the sample that I picked up there when I was thinking about this, and I'll just go through these very quickly. The College of Anaesthetists, the sepsis program, stroke, COPD, critical care, and the NOCA teams as well. So just a couple of slides on each of those. The College of Anaesthetists of Ireland, and I think this is a fantastic report, that the college came to us and they wanted to do something very simple, and I use this as an example for other people, and I have used it as an example for other people who've come to us looking for data or looking for ways of using HYPE to improve the quality of their work or of patient outcomes. So simply, this is an annual report led by Dr. John Cahill of the quality of the ASA score captured in HYPE. Now that's a very simple, clear piece of information. The ASA score is the American Society of Anesthesiologists score, and it will identify how healthy patients are going forward for theatre. So it's a really important patient safety piece of information that should be recorded on charts. So what the college wanted to do, they did an audit, they did this themselves, they used HYPE data, and what they've done by publishing those results, by saying that we're getting non-specific information on that ASA score, which is really important that an anaesthesiologist would record how fit a patient is for theatre. So they've seen a steady reduction in the number of anaesthetic record sheets where we just have the no ASA score. And we have an increase in the 2s and the 3s. So that's a really important piece of information on a patient's health status. But unfortunately, 27% of anaesthetic records still don't indicate the patient's ASA status. But what's really powerful about this report is that that's going back to the anaesthesiologists. That's coming from their college and going back to them And by publishing this report, and I think they're on to that, and I know Laura there in the audience, Laura Metcalf, one of our analysts, does a huge amount of work on this and works very closely with the college and with Dr. Cahill on producing this, and I think they're coming up to possibly their third report. So that's just a graphic of what I've been saying there. So what we really want is the ASAs 1, 2, 3s. I mean, we want to know how fit these patients are. ASA 9 is telling us nothing, and it's really important that, so you can see across the years, we're getting a nice increase in that green bar at 2015, and it's coming down there for the latest, for the 9 unspecified. So that's a very simple use, but a very powerful use, and it's getting right back out there to the clinicians and to improve the data and improve patient care. The sepsis program have been fantastic since we met with Christina and Vida. It's just been, you know, we have done so much with them and they've done so much with us, and this program, the report that they've produced as well, they worked very closely with us. And we're delighted to be collaborating with them so much, and I know that they're here today and they're great supporters of HYPE and great supporters of HYPE coders out in the hospitals, and with the sepsis nurses out in the hospitals as well. There's been huge collaboration here. And I think Jackie touched on this as well. You know, there is an increase in the number of cases, and this has come from the sepsis report that was published at the end of last year, an increase in the number of cases. But there's this uplift, obviously, there's clinical reasons for that as well, but I just think it's really important that we're able to provide, as HYPE coders, as you working in HYPE offices out there, this is where your data is going to. This is really improving patient care. It's raising awareness throughout the system about the importance of capturing this information. And this, again, a chart from the report shows a 15% decrease in age standardized mortality for inpatients with a diagnosis of sepsis. Really critical information. But with the help of the sepsis program, they have done numerous workshops, are up to do more. They want to do more to go back over those definitions, to make sure that sepsis data are absolutely being collected by our HYPE coders out in the hospitals. And you know, that collaboration is really powerful and really important. And we have a very close connection, I say, with the sepsis program, and I think that is reflected throughout the hospital system as well. So it's a really nice, again, nice use. That's a plug for ourselves. We won a prize, I think we won it in this room actually, for a poster we did on the work that we had done on the National Sepsis Program. And that was at an international conference, the PCSI conference. And it was the challenges of collecting that information in HYPE. So it was recognised as a huge body of work to get to where we are now. The stroke programme, again, have worked very closely with us, and we've really forged good connections there to try and improve, as Jackie showed you, to try and improve the specificity, what's available to coders, for the clinicians to understand the codes available to coders, what they can code, what they can take from the chart. The register encourages communication between stroke teams and those who code in HYPE, and that's from their national report. And we were very lucky to get a speaker then, an expert speaker, to come into us and talk to the coders, and that's going to be repeated again because it was so useful for coders to hear about the clinical side, because we are, you know, recording what's available in the chart, but it is important for us to understand as well these conditions. Just a couple of quick slides. We had meetings with the COPD and the pneumonia programs, and they've provided clinicians for us and experts for clinical training. The same with the National Critical Care Programme. I know Rory Dwyer's here today, and we thank him very much. He did come along, and he brought various implements, which caused great. I think we got to see things, which is types of ventilatory support, in case anyone's wondering. So that really makes it very, you know, alive for us, that we're that close to a patient, that close to patient care, and it's really important that we record those data as absolutely correctly as possible. Marina Cronin is here today, and together with Steve Burke and Colette, we work very closely with NOCA, particularly on NAM. We're on the steering and the governance committees. They ask us about HYPE data, which is wonderful, because if people find something wrong or want to question something or don't like a pattern, come and ask us and we'll be able to tell you. And we will act on their feedback on data quality. And they're out in the hospitals. They have teams out in the hospitals, and they're working very closely on those mortality data. And again, they published a report, and that is very much based on HYPE data. And just a quote from that: the strength of the NAM, which is the National Audit of Hospital Mortality, lies in its potential to help hospitals understand the relationship between the quality of data recorded in the patient chart, the accuracy of its transcription to HYPE, and how it can be used in conjunction with other quality indicators to pinpoint potential areas of concern. Absolutely critical information, all coming from our HYPE database. And the Irish hip fracture database, and I know Louise is going to speak this afternoon on this as well, and they've worked very closely and with our IT teams as well, and I know that they would use something called an add-on screen, and they're collecting a huge amount of information again for the Irish hip fracture database. But Louise and Marina are both speaking this afternoon, so I don't want to take away from what they'll be talking to us about. This was just, I was working with the NCCP, and they wanted to a question came up about this very particular procedure. It's only done in a couple of hospitals, and there was a question about the HYPE data. But because I was on that committee, that, I was able to immediately jump on that and say, well, what's wrong? What can we do? We talked, the surgeons met us, they were fantastic. They talked us through what we needed, and we were able to respond. We provided training, an article in coding notes. We brought in an ICS. A data entry check was put in, and we keep an eye on that to be sure that that particular procedure is only being done where it should be done. That was a very small piece of information, but we were able to act on it. So once we're at the table and you're talking to us, we're very happy to talk to anybody. So just to finish with any clinicians out there, we are very happy to work with, collaborate. Marie Glynn, our education manager, will nab you to present at a training course if you talk to her for long enough. But we really do appreciate and value as I say, that the importance of our collaborations with the clinical staff throughout the healthcare system, and that really has been a huge change that I have seen in the last 2 years. So that's the end of that piece. Sorry. So to save myself a trip up and down those stairs, I'm going to introduce our next speaker from here, and that's Dr. Kathleen McLennan from the Department of Health. And she is the head of the National Patient Safety Office, yes, which was launched last December. Thanks, Vinnie.